Good afternoon and welcome. Thank you all so much for coming here today. We have some really exciting news to share, and I appreciate you being here or watching online as we share this exciting announcement. There, I'll start again. I didn't know if it was working or not. So good afternoon and welcome, and thank you for coming today. We have some exciting news to share, and I appreciate you all being here or watching online to share in this exciting announcement. Before we begin, I would like to start with a land acknowledgement. The town of Georgina recognizes and acknowledges that we are on lands originally used and occupied by the First Peoples of the Williams Treaties First Nations and other Indigenous peoples, and on behalf of myself as mayor and all members of council, we would like to thank them for sharing this land. We would also like to acknowledge the Chippewas of Georgina Island First Nation as our close neighbor and friend, one with which we strive to build a cooperative and respectful relationship. We also recognize the unique relationship the Chippewas have with the lands and waters of this territory. They are the water protectors and environmental stewards of these lands, and we join them in these responsibilities. I'm proud to recognize that today is National Physicians and First Responder Day, and I feel it's very appropriate as we gather for this announcement to honor the dedicated professionals who stand at the front lines of care and safety in our community. But before we move on to the exciting news we want to share with you, I also want to extend a warm welcome to our guests and partners, including Caroline Mulrooney, MPP for York Simcoe, representatives from Southlake Health, including Dr. Paul Woods, and Leslie Ring from the Southlake Health Foundation, and Diana Brower, Chair of the Board of Directors of Southlake Health, David McCary, John Marshman, and Derek Rowland. There's also representatives from the Northern York South Simcoe Ontario Health Team, Christina Bazance. Welcome. I'd also like to acknowledge members of council that are here today. I have Regional Councillor Naomi Davison, Ward 1 Councillor Charlene Biggerstaff, Ward 2 Councillor Dan Fellini sends his regrets. I have Ward 3 Councillor Dave Neeson, Ward 4 Councillor Dale Gens also sends her regrets, and Ward 5 Councillor Lee Dale. Additionally, I'd like to recognize a few members of the town's leadership team who are here today that have been working very closely with Southlake on various initiatives, include our CAO Ryan Cronsberry, Deputy CAO and Treasurer Rob Weeder, and Sean Naskey, Director of Corporate Services. And I know there's many more, either staff or other individuals who have been integral to making today happen that are also present here. It's truly special to be gathered here today, not just for this event, but because this is the very first event to be held in our new Civic Center. Standing in this space marks an important moment in our community. This new space is a place where residents, staff, council, and community partners can come together to shape Georgina's future. And that is exactly what we are talking about today. Hosting our first event here feels especially fitting as we share plans focused on where we are headed as a community. So now, let's get to the reason we're here today. I'll now turn it over to Dr. Paul Woods of Southlake Health to share some exciting news.
Thank you, Mayor Quirk, and good afternoon, everyone. It's a pleasure to be with you all here today for another exciting announcement. Earlier this week, the Ontario government endorsed Southlake's vision to transform into a distributed health network. As we all know, Southlake serves some of the fastest growing and aging communities in Ontario. People in our communities have been very clear. They want care closer to home and will only visit a hospital when the care they require cannot be provided anywhere else. That is exactly what our distributed health network is designed to deliver. It's a new and more sustainable model, one that marries hospital-level expertise with community-based services, digital health, and strong system partnerships to better meet the needs of our growing communities. So today, I'm very pleased to announce that Southlake is launching a request for expressions of interest to identify a partner to support the development of an advanced care center here in Georgina. Advanced care centers will be a cornerstone of Southlake's distributed health network. These community-based facilities will be designed to expand access, reduce pressure on hospital sites, and improve the patient experience by delivering outpatient services closer to home. These services will be based on Georgina residents' current and future health and wellness needs, which have been carefully assessed through work completed as part of our tripartite memorandum of understanding with the municipality and our Ontario Health team. This work identifies an opportunity to co-locate services such as interprofessional primary care, diagnostic, and other ambulatory clinics to better meet the community's needs. For patients and families in Georgina, that means more convenient, timely access, a better experience, and another important step towards truly connected care. I want to thank our local MPP, Minister Mulrooney, and the Ontario government for supporting Southlake's distributed health network and endorsing this bold vision to transform care in our communities. And a special thank you to Mayor Quirk and the town of Georgina for your leadership, partnership, and strong commitment to improving access to care close to home, as well as the Northern York South Simcoe Ontario Health team, who have been incredible partners in our communities. This work was made possible through partnership, and we are grateful to be creating it with each of you. As we move forward with this request for expressions of interest, we hope this opportunity inspires local philanthropy from those who share our vision for leading-edge care. Together, we're building the future of care and bringing it even closer to home. Thank you. It is now my pleasure to welcome Caroline Mulrooney, MPP for York Simcoe.
Thank you, Dr. Woods. Good afternoon, everyone. It's such a pleasure to be here, and I really want to congratulate the town of Georgina on this incredible new building. And I think it's so fitting that we're in this modern, bright new building for this first announcement on healthcare, which is really the #1 issue that touches all of us in Ontario and all of us here in Georgina, and that we're here announcing something that is really going to affect the future of healthcare here in Georgina. So congratulations to the town for this. This week marks a historic milestone for families across York Simcoe. Earlier this week, as Dr. Woods referenced, the Ontario government and Southlake Health shared some truly exciting news about the redevelopment of Southlake's Davis Drive campus, including plans for a brand new state-of-the-art acute care hospital in East Gwillimbury. Supported by a $10 million provincial investment, this announcement represents a major step forward for families across the region. Today, we're building on that momentum by transforming care across Northern York Region and Southern Simcoe County by endorsing Southlake's vision of becoming a distributed health network, beginning right here in Georgina with a plan for a new acute care center. This underscores our shared commitment to families and residents across the region to provide quality care in their homes and communities. Advanced care centers are a key part of Southlake's distributed health network model, and I want to acknowledge Southlake and its entire team for their leadership in cultivating and advancing this forward-thinking approach to healthcare delivery. And I'll never forget the first meeting I had with Dr. Woods in his office when he explained the need to distribute the care across York Simcoe and how it was going to help communities across this riding. And so I want to thank you for your leadership. I look forward to these vital investments in primary and acute care, which will make a meaningful difference for residents in my riding. Under the leadership of Premier Ford, our government is delivering on its plan to protect Ontario's healthcare system by investing $64 billion to build and upgrade more than 50 hospitals across Ontario. We will continue to deliver on that commitment, bringing high-quality care closer to home, right here in Georgina and also in East Gwillimbury and Bradford. Again, thank you to everyone for joining us here today. I'd now like to introduce Christina Bizantz, co-chair of Northern York South Simcoe Ontario Health Team and president and CEO of CHATS. Christina.
Thank you very much. It's really my pleasure to be here on behalf of the Northern York South Simcoe Ontario Health Team, which I'm going to shorten and call it the NICE OHT going forward. And I also want to begin by acknowledging MPP Mulroney, Mayor Margaret Quirk, and members of council, Southlake Health, the town of Georgina, and all the community partners who have been focused on improving access to care for residents in Georgina and across Northern York region. Today's announcement is an important and positive step forward. The request for expression of interest reflects the type of collaborative, community-focused planning that is needed to bring care closer to where people live. This work aligns very nicely with the Northern York South Simcoe OHT's shared vision of building a more connected, coordinated, and neighborhood-based health system. Georgina is a growing and unique community with its own population health needs, geography, access challenges, and opportunities. Ensuring that services are designed with those local realities in mind is absolutely essential. This initiative also builds on the original commitments made through the Memorandum of Understanding between Southlake, the town of Georgina, and the NICE OHT. That tripartite agreement was rooted in a shared commitment to better understanding the needs of the community and to work together on solutions that improve access, coordination, and patient experience. As the population health assessment and MOU report are finalized, the findings will help inform the types of services and partnerships that may be most valuable in a future advanced care center. This is exactly the kind of evidence-informed planning that helps ensure investments are responsive to the needs of residents, families, caregivers, and providers. From an OHT perspective, this is not just about a building or a single service. It's about creating stronger connections across primary care, hospital care, community services, home care, mental health and addictions, senior supports, and other local partners. It's also about making it easier for residents to access the right care in the right place at the right time. The NICE OHT is pleased to continue supporting this work through collaboration, partner engagement, and alignment with broader regional planning. We look forward to continuing to work with Southlake, the town of Georgina, local providers, community partners, and residents as this important opportunity moves forward. Congratulations to everyone involved in reaching this milestone.
So wow, what a fantastic day, fantastic announcement. Thank you, Dr. Woods, for your work on this. MPP Mulroney and Christina Pazance, thank you. I'm thrilled about this monumental step forward in our journey towards expanding health services right here in Georgina. As mayor, I'm grateful to our partners at Southlake Health and the Northern York South Simcoe Ontario Health Team. I prefer to call it the nice one too, it's a little easier. For acknowledging the importance of locating this facility here in Georgina and the commitment they have shown to advancing this crucial initiative. The procurement process being launched today is a significant milestone that will propel this project forward and one that will benefit Georgina residents for generations. Today's monumental announcement moves us significantly closer to creating a local health and wellness facility right here in our community, a facility that will be responsive to the unique needs of Georgina residents. This important part of the process will guide us in the direction of a site for the new Advanced Care Center and provide further clarity on the timelines for the completion of the project. And I look forward to broad participation from our community in responding to this initiative. As you know, it was only 2 years ago that I, as Mayor of Georgina, along with Southlake Health and the NICE Health Team, signed a memorandum of understanding to create an advanced care facility in Georgina. Today, the vision that I and others had with that MOU is coming closer to reality. Since that MOU was signed, we've not stopped in our efforts to expand health services in our community. Just last year, I, along with members of council, joined Southlake's announcement on the expansion of its cardiac prevention and rehabilitation program in Georgina, providing leading-edge cardiac care closer to home for for patients in our community. The Advanced Care Center that we are talking about today will further bolster accessibility of healthcare in Georgina, ensuring that our residents can benefit from the comfort and convenience of nearby care. The words "it takes a village" ring particularly true when we talk about the goal of delivering meaningful, integrated health services for Georgina residents. In addition to the work done by Southlake Health, I wish to recognize the important contributions of our very own councillors. Advancing healthcare in Georgina doesn't happen by chance. It happens through thoughtful discussion, difficult choices, and a shared willingness to act in the long-term interests of our community. Council has consistently demonstrated leadership by identifying healthcare as a priority in our strategic plan and supporting the decisions needed to move these initiatives forward. As part of that village, I would like to acknowledge the efforts of Councillor Dave Neeson, who has been working with Leslie Ring, Chief Development Officer with Southlake Health Foundation, to inspire philanthropic support of our caring community to bring leading-edge care closer to home for our residents. Thank you for this important work. And there is more work to be done, and I look forward to the results of this next phase and continuing the momentum to deliver Georgina's Advanced Care Center. Creating a healthier community for all is a cause we are all passionate about. And today's announcement further illustrates our joint commitment to deliver on this initiative in a meaningful way, with timelines that reflect the growing needs of our community. So thank you very much for joining us today. I'll now turn it over to Derek Rowland from Southlake Health to assist in answering any questions. So thank you.